There are abnormal rhythms in the brain that propagate throughout the body in patients who have dystonia and other movement disorders. And we don't really know how these brain stimulators work, although I think we're starting to get some better ideas about that. But at any rate, placing this wire inside the brain and delivering electricity somehow jams the abnormal rhythms that are present, or replaces them with something else, or inhibits them, and results in remarkable benefit for appropriately selected patients with dystonia and other movement disorders. As a matter of disclosure, I have research funding from the National Institutes of Health, from the National Institutes of Neurological Disorders and Stroke, and I work for UAB. And I may talk about some things that are not FDA approved, and so if I do, I'll try to highlight that to make sure that you are aware of those kinds of discussions. So I'm going to overview dystonia and talk about, in particular, this brain stimulation procedure, which many of you probably read about or heard about. And I'm going to talk about some of the best evidence that's present for the treatment of the symptoms of dystonia with DBS. And if we have time, we'll look at some videos and talk about some of my research interests. And I would like to say that I'm here for you. So I would like to give you the information that you need to have. I have to leave around noon to get back. However, I would like to be able to answer some questions before I leave if it's possible. So I know I'm kind of speaking to the choir here, as they say, but dystonia causes twisting abnormal movements. They tend to be rather slow. They have irregular rhythms. They're at least slower than tremor. They're slower than another movement disorder called chorea, and certainly much slower than myoclonus. And for some reason, the brain is telling the body to assume a position that it doesn't really need to assume. And so it causes these kind of drawing type movements, and they can affect a focal part of the body, which is overwhelmingly the most common kind of dystonia in adults. So cervical dystonia, where the neck twists and turns to the side, blepharospasm, where there are involuntary eye blinks, dystonia of the vocal apparatus, or spasmodic dysphonia, and writer's cramp. These are the more common types of focal dystonia. They tend to occur in adulthood or in young adulthood, and less common are so-called, and there are overlaps among all those types of dystonia. So some people have a little flavor of more than one of those focal types of dystonia. Less common are the generalized dystonias, where lots of the body is affected. They tend to be earlier onset. So generalized dystonias happen more in children, although they can happen in early adulthood. One of the common characteristics of patients with any type of dystonia is called a sensory trick, or in French it's called the geste antagoniste. And this is the tendency of patients to place the hand on the part of the body that's affected by the dystonia. And rather than physically pushing the body back into place, there's something about that sensory contact that provides patients with relief. And so patients with blepharospasm will touch the eyelids. Patients with orolingual dystonias will put a handkerchief on the tongue to keep it from protruding. Patients with cervical dystonia, overwhelmingly, I'm just looking in the room right now, and it's very interesting. It's just interesting to look at this group, because I'm looking at every one of you and just sort of going from person to person. It's kind of a unique vantage point up here. It's like a kind of a macroscopic or a large-scale view of what my clinic is. But at any rate, dystonia is often bizarre in the sense that it's very different from one patient to another. And patients with dystonia often feel stigmatized because they're told by people that they have some sort of hysterical condition, and it's unfortunate.